Hello, Kirka. We are a group of junior nursing students. My name's Nikki.
My name's Carly.
I'm Liza.
And my name is Alex.
We are passionate about improving patient skin integrity. Our research revolves around comparing methods of incontinence care with either underpads or briefs regarding patient and nursing preference with skin integrity outcomes.
There is little research regarding which product, underpads, or briefs have an advantage for skin integrity and patient satisfaction.
We want to evaluate these propositions comparing which product leads to the least skin breakdown versus the patient's preference in regards to their own comfort and convenience.
And then with the methods section, this research could change the standard of incontinence product use regarding which product would have better outcomes for patients and nurses and which will lead to less pain and suffering for incontinent patients.
Pre and post survey would be given to nurses to determine the effectiveness of each product, responsiveness of the nursing staff, and overall preference. Daily nursing skin assessments will be conducted throughout the study. A pre and post survey will also be given to the patients to determine their comfort, mobility, and overall preference to each product.
In summarizing the synthesis of evidence, multiple factors relate to the incidence of skin breakdown, such as the reaction time of nursing staff, the amount of barrier cream used, less is better, skin cleansing agents, and the material of the product. The normal skin pH is 4.4 to 5.5, yet exposure of urine and feces to the skin raises the skin pH, making it susceptible to skin breakdown.
And extensive amounts of barrier cream use can alter the pad and brief effectiveness by making them waterproof instead of absorbent. Thus, the urine remains on the skin rather than absorbed into the pad or brief. A water-based barrier cream is recommended to sustain the absorbency of the product, as well as to ease the inspection and to limit the reapplication occasions.
Other factors that contribute to the extent of skin breakdown include use of various catheter types, which limits the skin's exposure to feces and urine.
A huge factor in skin breakdown is also how often a patient is turned and repositioned. The mental status of the patient, their age, and their critical condition are considerable factors leading to an assorted skin integrity results for better or for worse. In planning our study, after proposing the research project to the nursing managers, a budget would be configured regarding availability of the amount of product that we can use.
After the pre-surveys and throughout the study, the research team will periodically check on the compliance of the nursing staff regarding the use of skin assessments and adhering to the brief or pad patient. This would eliminate areas for many errors in the study, further rendering the study credible.
Plan to comprise the research and benefits for underpads and briefs from the surveys and compare them to better understand the best product to use for incontinence care. After compiling this data, one product and method may stand out over the other, rendering this approach a new standard for best practice.
In ACT, after compiling this data on the superior product, an educational briefing to the nursing staff and the hospital supply managers would be presented along with posters or posted around as a reminder for nursing staff, as well as a pamphlet given to supply managers, which could implement even greater change in how facilities use incontinence products for the well-being of their patients.
The research is significant in order to assess our current practice of the use of briefs and pads for incontinence and to evaluate the most comfortable, preferable methods for patients. Additionally, in the hopes of reducing the risk of infection, skin breakdown, and longer hospital stays, improving patient outcomes and comfort overall is the drive behind this research.
And then along with our poster, we attached three figures. So figure one, that actually displays an adult brief, which would be used in a healthcare facility. And figure two, that's an underpad that's typically placed under the patient on top of their beds during the healthcare facilities to collect urine at all. And then figure three, so that actually shows the occurrence of skin breakdown during that, well, what can happen during improper incontinence care. So this is actually what we're trying to prevent in patients to ease their comfort. And then along with our research, we did attach references, which would be in the next slide that we're just going to show. And then these are the 5 references we used to go about the research of our project.